Hello, I'm Dr. Janette Nesheiwat. I'm here at Northwest Medical Center, and we're here in the cath lab to talk about new procedures in cardiology. And I'm here with Dr. Michael Green, cardiologist here at Northwest Medical Center. Dr. Green, tell us, what is heart failure?
Heart failure, there are two basic types. One, you have a heart that is enlarged and doesn't like to squeeze. That would be called the systolic type. The other type is diastolic heart failure, which means that the heart is stiff. It doesn't like to relax, so it can accept the blood that is returning to it from the upper chamber and then dispense it out to the body.
I see. And what causes heart failure?
Well, the systolic kind, where the heart doesn't squeeze normal. There are several causes. The number one cause would be having a large heart attack that causes significant damage. The second cause, albeit less, would be a viral cardiomyopathy, where a virus actually causes damage to the heart and results in a poorly pumping heart. Now, as far as the diastolic heart failure, the number one cause of that is coronary artery disease.
I see. And tell us, what does blood pressure, how does that play a role in developing heart failure and heart disease?
Well, blood pressure puts you at risk for developing coronary artery disease, which will subsequently lead you down the path of the diastolic heart failure. So if you look at reducing the blood pressure, it makes the heart more efficient in relaxing and not being overworked to try and overcompensate for the blood pressure. Blood pressure is nothing more than resistance the heart has to work against.
I see.
And then if someone has a poorly squeezing heart, then that blood pressure is going to directly result in the heart failure. So the lower that you get it, the more efficient that you make the heart pump.
And diet is very important as well. Salt intake, that has an important effect, as well as alcohol intake, for example. Salt
is directly relation to the blood pressure being elevated. So if we have patients that have been refractory to medications, we clearly try to urge them not to take in salt, use salt substitute, and that way hopefully we can gain adequate blood pressure control with their medications.
I see. Tell us, what are some of the risk factors for heart disease?
Well, it depends what type of heart disease you look at. If you look at the number one cause of mortality and death in patients with heart disease, it would be coronary artery disease. So the risk factors are elevated blood pressure, elevated cholesterol, sedentary lifestyle, diabetes, nicotine dependence, and family genetics.
That's what I was going to ask you next. How is heart failure diagnosed, Dr. Green?
Normally a patient will present to the office or present to the hospital. They're going to complain of lower extremity edema. They're going to be short of breath with minimal activity. They might even wake up in the middle of the night feeling like they're gasping for breath, like they're drowning. And so that leads to a chest x-ray, which will show fluid on the lungs. It will show an enlarged heart. So then after that's diagnosed, you proceed on to a transthoracic echocardiogram, which is an ultrasound to look at the heart, and ultimately probably results in a heart catheterization.
We talked about some of the risk factors earlier. Some of those risk factors are preventable. So that's one of the, I would say, treatment options, is to prevent it in the first place. But what are some of the other treatments that are available to someone that's recently diagnosed with heart failure or heart disease?
Well, what you have to understand is there are multiple causes of heart failure. Let's say a patient has a leaking valve. And the heart still squeezes fairly normal, but the valve leaking, meaning blood going backwards through to the heart, overloads the heart, which results in the lungs getting congested and the patient becoming short of breath. And so sometimes, you know, to get the patient over that hump and stabilized, you know, there are different ways to address it. Number one is coronary artery disease playing a role, and if not, with the valve leaking, would they benefit even being put on like a heart pump?
And I understand there's a new type of heart pump out, and you're one of the first cardiologists in this area to perform that procedure. Tell us about that procedure and the device that's involved.
Basically what you have is you have a catheter that is placed through the right groin, up through the aorta until you get to the heart. And then you cross the aortic valve, and then you place the distal end of the catheter into the ventricle, and then the other end that sits up above the aortic valve allows blood to be pumped out into the aorta, so then it can go to the kidneys, the arms, the lungs, or brain. It pumps 2.5 liters a minute.
So what is the difference between this new device versus older techniques and older procedures?
Some of the older techniques would be like a balloon pump, and it does have its role. And this new heart pump is not for everyone. I would tell you that, for instance, like we talked about a leaking valve, you know, if the aortic valve is leaking, a balloon pump is contraindicated. You cannot use that on them. So that might be a patient if you have, and they're normally very sick. So by putting them on the new type of heart pump, it will stabilize them for surgery.
Who else is a candidate for this new device?
Well, I mean, there are several. Anybody whose heart's that's enlarged, that you're trying to either stabilize after a heart attack, or will need stenting, or even, you know, if they're really sick and you're trying to stabilize them to get them to surgery.
I see. Is there? I'm sorry. Go ahead.
The other patient I spoke of is the viral cardiomyopathy. Normally, those patients don't recover function appropriately, and they might end up needing transplant, and this will be a bridge for that patient until he gets his new heart.
And as far as age groups, is there a certain age group that you see that people are requiring this sort of device? Does heart failure occur in a certain?
Applies to all ages.
Okay, and men, women equally? Pretty much. Okay, what is the prognosis after receiving this this device, having this procedure? People that are diagnosed with heart failure, heart disease, what is the outcome after treatment?
I think the outcome, if you can correct the cause and then get them stable on a variety of medications, if they need revascularization or they need a new valve, the outcome will be good. Basically, the patient is placed on the table. Their groin is prepped and draped, just like if you were going to do a heart catheterization. You gain access into the right common femoral artery, and then you take that catheter and you place it what we call retrograde, which is just basically a fancy term for backwards, up to the heart, and it crosses the valve just like our catheters that we use to inject dye in the main pumping chamber. Once you get that in place, you then connect it to the machine, which is at the end of the table, and basically after you prime the pump, that's it.
How long does the procedure take?
5 minutes.
Success rate?
Not everybody you can do this on because it is a very large caliber catheter. It's probably about the size of your pinky finger.
Oh, okay.
All right? And so if they have peripheral vascular disease, you know, you may not be able to do that for them. So it's not for everyone.
So it's just one of the options that are available.
It's just a new option to try and improve outcomes.
Where can one go for more information about heart failure and heart disease and this new procedure that's available?
I would say heart.org.
Okay, and American Heart Association as well can provide more information on how to prevent heart disease in the first place.
Okay.
All right. Stay tuned, Family Health Today will return in just a moment.